I'm a socialite. I am fantastic. I am the partier. I am the go-to, the person you want to speak to, the person you want to be around, the person who knows people, but I'm also completely broken. My name is Devon. I'm a very extroverted person. Sometimes I can be an introvert, but there's that saying, what you see is what you get kind of thing, but it's a lot more than meets the eye because I have a lot of other facets of myself that a lot of people do not know. I'm diagnosed with severe anxiety and mild depression. Today we are getting more into that.
My name is Lorenzo. I would have to say that I'm a very curious explorer, like to figure out stuff, learn new things, and then if it's valuable enough to help somebody else, share that in a nutshell. And I would have been diagnosed with major depressive disorder.
Hi, my name is Dr. Edmund. I've been a doctor for the last 10 years and I've been training in psychiatry for the last 4 years.
I'm Dr. Kelly. I am a general practitioner currently working in the field of psychiatry.
How do I condense? So one, depression is way more common than we accept. Two, it looks differently on different people.
Depression doesn't matter the type of depression, persistent, major, it doesn't matter. Mental health is still very taboo, but I want people to recognize that it is an illness. It's just as real as diabetes and just as real as hypertension. And you will not tell a hypertensive patient, oh God, your pressure just high, just get over it. You wouldn't do that. You would encourage them to take their medication, to exercise, eat healthy.
Anybody can experience a mental health crisis. There's no limit, there's no specific profile. At any point in time, it could be me, it could be you, anybody in your life. Sometimes situations become so overwhelming and we get to the point where we may not be able to handle it as best as we could.
My dad never wanted boy children. Yeah, so it was like I couldn't do anything right, and that was a problem. So it was always criticized, physical, but I used to get red licks for like everything. And that kind of came to a headway when I was about 8, 9 in school. I was extremely aggressive and angry with the world and would literally get into fights in school like every day. The other angle, I've modified my language now to say that I didn't grow up poor, but I came from extremely humble backgrounds. Like I know what that struggle is. I know what the lights being cut for a while and that kind of nonsense is like, right? And that played a huge part as I actually got older. My lack of a relationship with my dad and subconsciously really yearning for that, for want of a better term, acceptance, that actually extended into what became more of, I just felt like I didn't fit in. Like I didn't belong anywhere. And that was difficult to process.
Apart from genetics, persons are at increased risk of developing a depressive disorder if they having a baseline of a low self-esteem prior, experiencing traumatic events at a young age.
You can see an onset of it as an adolescent or child. It's quite multifactorial. So if you don't have the ability to cope well with circumstances, if you have experienced trauma, so like physical or verbal abuse, death, grief could trigger it on.
It was really 2016. I lost a lot of people. It was my best friend in the beginning, and then it was my grandfather that passed away right after, about 2 weeks after, and then like 2 or 3 months after, one of my really close friends drowned. Around that time also I gotten into somewhat of a what we millennials call a situationship. The person was very manipulative, emotionally abusive. It was a lot of like a mental gymnastics, and it taught me a lot about myself because I also struggled with, my sexuality, and I didn't know who I was. I was trying to fake this whole life. So it was a bit of a struggle as to how do I deal with loss and how do I cope?
Oftentimes what happens is that persons experiencing it, they have difficulty because they feel like it's just something that they're doing wrong. So sharing this with friends and family may be difficult.
Most times when you're in that space, you think nobody understands. That's usually the thing, right? Like that mask, yeah, you wouldn't know.
You're just looking good on the outside, but you feel like the whole entire you is just gone. It's a feeling of a kind of emptiness.
Depressive disorders are actually broadly categorized into about 5 main categories, and then there are subcategories. Symptoms have similar, like they have overlaps. So because of the overlaps, when we are diagnosing a patient, we have criteria that we have to follow. That criteria is very specific and very, very important. But it just goes back to, you are persistently sad for most of the time, most of the days.
Experiencing depression, there is changes with sleep, so it could be hypersomnia, which is sleeping for longer hours over the years, and then insomnia, which would be inability to sleep.
When I was going through that period, I did not get a lot of sleep, like 2 to 3 hours of sleep a night.
Changes with your appetite, so eating more than usual or eating less than usual.
I started to lose my appetite completely. I did not want to eat. I didn't eat for days on end.
You know, they might just realize they're losing weight or gaining weight without even trying.
And I think at one point I had lost like 50 pounds just like that because I just was not eating.
Low drive to do anything.
You know, it showed up in my work where I actually started to underperform.
They may be a bit cynical in how they speak.
Defenses was automatically up. That used to obviously end up in like big arguments, like lock off completely.
They feel unworthy, they don't deserve happiness, or if they even experience happiness, it might be short-lived.
I want to make sure everyone around me is having a good time. So I will feel like I'm having a good time when in reality I'm not.
I feel like I'm not seen. I feel like I'm not appreciated. I feel like I'm not loved, and anything that makes me feel like that will trigger me a bit.
You would notice that your loved one is probably a little more withdrawn.
Isolating, not engaging.
My family will know that I'm distant, but because I'm usually in my head all the time, I'm usually always distant. And it has a lot to do with how I would have coped.
They kind of shy away from social interactions.
They're not interested in doing any activities that they usually enjoy.
It started to overlap into the social setting where I get social anxiety now, where now I don't like to be around a lot of people, even though I'm still very extroverted.
And sometimes they may start doing things that may not be in keeping with their character, like using substances, drinking more alcohol, using cannabis.
Alcohol was one of the substance abuse. I would be drunk all the time. I just didn't want to feel anything, so I would drink, just not to feel.
When you're at that point, you do things to try to fit in, which sometimes is almost contradictory to who you are as a person. And that conflict in and of itself creates a whole problem.
Sometimes these things are done to cope with what they're experiencing internally. Usually anybody who's close to that individual will be able to notice subtle changes. In order to help it, you want to stay away from labeling the individual, as that would simply worsen their symptoms. Because what you may be seeing are the actual symptoms. So you're seeing the increased fatigue, difficulty making decisions. They don't have energy to clean up after themselves. So shy away from using labels like lazy or being like don't care or irresponsible.
My mom would have recognized that I was living at home at the time. She saw a difference in my behavior. And then my sister, she's my rock and my confidant. She was the one who opened up my eyes about mental illness and seeking help.
I have my son's mom to be extremely grateful too, because it was literally her forcing me to go to some therapy sessions called original pain therapy, which explores the whole childhood thing, right? That was extremely helpful for me to comprehend some of the stuff that I was still battling as an adult.
So if you feel as though you may be depressed, the best person I would say would be somebody who's a trained professional, because of course there's the confidentiality, you can be as vulnerable as possible, and there's also the expertise and the knowledge behind it to be able to determine whether you really are experiencing a depressive illness that needs treatment. If you are in any sort of school, secondary, tertiary, you would have access to a psychologist or a counselor. That's one method. If you have a job, you can use your employees assistance program and get access to a psychologist as well.
Trinidad and Tobago, we are divided into regional health authorities. So we have the Northwest Regional, the Southwest, the North Central, Eastern, as well as Tobago. So in each of those regions, there are specific health centers with mental health clinics attached to them. Or you can go into St. Anne's Hospital. I know people think St. Anne's is like, I don't like to use this term with crazy people, but it is a psychiatric hospital. I stress psychiatric because it's for all mental health illnesses. There are an array of mental health illnesses. Because someone has a mental health illness does not mean that they are crazy. Go into St. Anne's and there is a section called the assessment unit where you'd be interviewed by a medical professional, and if medication is required, you can be given medication, and you can also be redirected. You'll be given a referral letter to the specific mental health clinic within your area.
Some people require both therapy and medication. Talk therapy addresses the psychological aspect, but at times that may not be enough. It depends on how much the illness is impairing one's lifestyle.
The help part without oversimplifying it. The acceptance that I can't change what happened to me, but I could definitely change the way that I perceive it and therefore react or respond to it. So yeah, let's destigmatize that seeking professional help means something is wrong with you.
What I found was a really good resource. There's a website called findcareTT.com. So when you go onto that website, it has a host of all the resources available. If you feel like you'd even have the strength to reach that far, confide in somebody that's close to you.
It's good to speak to somebody that you trust, someone who you consider to be safe, that you're able to be vulnerable with, and someone who you're not afraid would use the information in any sort of negative way. So whether that be a very close friend, a close family member, if you are going to try to help, one-on-one may be better than a group approaching.
Everybody processes and deals with things differently. So like if you are the person that someone who is going through that depressive episode comes to, you're being emotional, yeah, don't say that. It's not that bad, don't say that. You're overreacting, also don't say that. Don't judge. You might process something to be easy that someone else doesn't find that easy.
Don't prod them into, oh God, you're alright, you're okay, what's going on. If you know the person already, you will kind of already know what they like to do. You also care about the person, but you also want to give them a space for them to feel comfortable enough to come to you and speak to you about whatever the issue is. When we create that space, it's a whole other ball game. They just start to offload and they start to talk about everything without you saying a word.
A generally healthy lifestyle is really important for your mental health. So eating well, exercising regularly. Exercise, we release our feel-good hormones, the endorphins. You feel great. Eating healthy, having nutritious foods, because sometimes imbalances in your nutrients can actually be the cause of your depression. So when you have a well-balanced, nutritious diet, that helps. Sleeping well is important. You know what I think is very helpful? Having a gratitude journal, which you can add to your morning routine. I'm a support and advocate for it.
Writing definitely worked for me. Music was real helpful for me too at certain points in time.
Making new connections for me is something that I realize that it's not just me alone that goes through a lot of things. People share stories and you realize that you're not alone. So it's also a coping mechanism where you have more support than you had from before. It's really about trying but also forming those good habits then.
So it's always important to be kind, compassionate, and if you are experiencing these things, it's okay to reach out, it's okay to ask for help. Work on having healthy coping strategies in place for whatever comes along in life.